grace with us as we have extracted ourselves from the breakout sessions. Please, Maggie.
Yeah, so I think we'd like to just take a moment to kind of share between the two groups of what was discussed. So I can start, Katie, and report out a little bit about our group. So we did high value care and removing barriers to health and well-being. In general, folks like the tactics, but also had some really robust and interesting ideas that I think we want to explore, take back and see what we can do with them. This included, there's a lot of communication about PEBS benefits, but how do we reach people and not just have them get an email and delete it, right? So thinking about how relationships can help people really engage and further their understanding and utilization of their benefits. We also talked about one of the tactics proposed was around the EAP and kind of looking at different cross sections of PEBS members. And in addition to looking at things like demographic data, can we also look at what workplaces, so which agencies and what the utilization is like between different agencies. We also talked a little bit about some exciting rural programs to help connect members to care, including one that leverages paramedics in rural communities to help kind of frequent flyers to the ER and reduce those visits as they can. We also talked about health literacy and the languages available. Maybe one suggestion was piloting an in-person sort of meeting or event centered around benefits, but fully in a different language, not just translating the materials. So something for us to think about and see if we could do with some engagement from folks in the community. And then also I think a repeating theme that we talk about often is around food insecurity and food as medicine. And have there been any further developments in terms of guidance or federal regulations or taxability, things like that? Like, can we take another look? Can we get creative? So just some additional ideas for us to think about as we kind of start on this roadmap. And Katie, would love to hear what your group chatted through, or Emery.
Sure, I think Emery has all of the notes, so I'll let him give some specifics. But our group has, we looked at access to care and culturally responsive, and we spent a lot of time on access to care. We understand there's some overlap, but generally it sounds like similar to Maggie's group. There was a lot of consensus for the tactics that are listed here. Generally, nothing major recommended to remove. A lot of the talk was around, having this be part of PEB's RFP and how this would be part of the evaluation process to look at some of these things and how we would be working with different groups like such as CIAO on some of these initiatives as we actually build out the 3-year roadmap. There was talk around culturally responsive care and training and how we can continue to educate members on that training that's required, not just for like one type of provider like mental health providers, but how it's required for first responders and all other types of providers, PCPs, et cetera, and how do we get that word out and continue to get that culturally responsive care working really well. Emery, I don't know if there's a few other examples you'd like to add in as well.
No, I think there's you touched on pretty much most of it. I think one thing that kind of struck to me was it's not just necessarily PEB, but it's kind of like in connection with OHA and the state in terms of the things that are happening and the reforms that are wanted. The cultural trainings. It's like some of the things. It's like maybe with the providers, with medical homes, what they are doing with the language surveys that they get, and just being able to communicate with not just maybe the parent, but the rest of the family as well. Just kind of like overall, like what can PEB maybe have liaisons with like OHA and some of those actions, those transformations to kind of help make it more impactful in that case. So I think Emily definitely put out her name to and some things she's been doing that she might be able to, also bring back and to be a connection point with that. But yeah, the RFP, I think, and the requests of the plans, right? It's like, what are we looking for? And are they addressing it? Are they actually taking those steps? And part of it's also, are they able to do some of the things, right? It's like, do they have the data? Do they have the technology to gather the information, to gather the right information, and to see if changes are needed, or, just understanding lay of the land in that case. I think those were some of the themes I heard in our conversations.
Also just having that, like you said, the member education, or they know what benefits work the best for them and presented in a way that they can understand and it works for their family, their entire family, not just the individual.
Thank you. Does that close out the?
Yeah, so next steps, we're gonna take your feedback back and we'll kind of start to work on a strategic roadmap within the committee. We'll bring that to the work group. As a reminder, Siobhan and Sean are our work group representatives from PEBB. And then from there, we'll kind of decide next steps for sharing out with the board.
Thank you.
And if you think of anything else, send us an email or ask for a call. We're happy to chat through ideas.
Thank you. Thank you for that work and for facilitating those breakouts. We really enjoy digging into the details, and there's never enough time. So I welcome those opportunities and appreciate the ask for direct feedback on strategies. I think that gets our brains moving in the right direction. All right, so next on the agenda is other business or public comment. I didn't see that any had come in. Ali or others are.
Rose, your public comment?
Rose, do we have any public comment?
No, there's no public comment.
Thank you. Okay. All right. With that, is there anything else here for the good of the order?
Hi, this is Ruby Castillo. I'm looking for the RFP. Just real quick, verbal update. We plan on closing the RFP this Friday at 5 o'clock. And we'll be announcing all the people that have submitted, or all organizations that have submitted a proposal. So, and that'll be at 5. So if anybody wants to attend and listen to that, you're more than welcome to. So that's all I had.
Thank you for that update, Ruby. Last week for submissions on that RFP. That's exciting. That the RFP closes this Friday. All right. Thank you very much for your participation, for your attendance at our November PEBB meeting. Board members and others who have attended in person, thank you very much for making the trek and reconnecting. And we will look forward to seeing you all in December. Take care. This meeting is adjourned.
Thank you.
Thank you.